All right, let's come to this, though. Why me? What did I do wrong? These are just some of the questions that most mothers who give birth to premature babies ask themselves. But with today being World Prematurity Day, we speak to senior specialist neonatologist, that's Dr. Gugu Kali from the Tygerberg Hospital Children's Trust. Well, the hospital is on a drive to get breast milk donations, and Dr. Kali will also share some insight on caring for premature babies. Doc, good to have you. Good morning, and thank you so much for joining us on this very much important topic. I mean, are these really some of the questions that, mothers who give birth to premature babies ask? Is there a sense of guilt for a mother or a parent when they have a preemie baby?
Yes, it is. It is questions that we often get asked by the mothers. And we have to reassure them that often there's nothing that they did that could have prevented it from happening. However, there are things that they can do to give their babies their best chance, and one of those is to have as good a diet as they can, and to attend antenatal care, and to not partake of some things like smoking and substances of abuse and alcohol.
Even though we know that most premature babies do normally develop normally after birth, what causes premature birth?
Various things can make premature birth likely. So, as I've mentioned, poor maternal nutrition is one of them. Some infections can also make it more likely. Things like HIV, and then smoking and alcohol, which is why I think people should try and avoid those if they're trying to have a baby.
And how would you advise mothers as well as parents overall to care for premature babies, Doc?
You mean once they've got them?
Yes, once the baby has been born prematurely, how would you advise parents and mothers to care for them?
Okay. So one of the most important things that mothers can do is to provide breast milk, which is why we are on this drive that we all talked about just now. Also, one of the things that also helps premature babies to develop well and to resist infections is to practice what we call kangaroo mother care, where they put the baby on skin to skin on their chest when they're caring for the baby. It also improves their chances of successful breastfeeding.
And also, just for clarity's sake, I mean, when we talk about premature babies, these are babies that are born just before 37 weeks. So can the days shift, I mean, in terms of the weeks or the time with which they were born, or is it babies born right before 37 weeks?
So there's a wide range of prematurity. So by definition, it is before 37 weeks, but it can be as early as 28 weeks or even 25 weeks. So there's extreme prematurity, which is really below 28 weeks. And then there's a higher later prematurity. So you have different risks depending on how premature the baby is.
Right. What are some of the myths that perhaps you would like to demystify, given that we are, of course, commemorating World Prematurity Day today, that you think, mothers as well as parents who, are taking care of premature babies should know about? But specifically, when we talk about the myths, what are some of those that you would like to actually just clarify and demystify today?
Well, one of the things, I'm not sure if I can call it a myth, but the breast milk issue is a very critical one. So some people seem to think that it doesn't matter, you can just buy milk and it's as good for the baby as breast milk. Whereas breast milk is actually critical for a baby that's born premature. It can prevent some serious problems that premature babies can get. So that is one thing, which is why the Tygerberg Children's Trust and the hospital is on this latch-on drive at the moment to get breast milk donated.
Right.
That don't have their own mother's milk.
Yes, and that's why you're doing this drive, and the appeal is for the public, of course, to ensure that they assist where they can with breast milk donations. So thank you so much, Dr. Gugu Kali, for talking to us this morning.